My name is Dana Arnone. Believe it or not, I once dreamed of a career in fashion journalism, but life had other plans. I became a registered nurse and eventually the owner of a home health care agency in Long Island, New York. Now, I'll be honest, some days are hectic and sometimes I just want to scream, but my mission and my passion is what keeps me going, helping seniors navigate the chaos of aging in today's world. Every day I see the challenges our seniors face, and it drives me to fight for change, because no one deserves to face the end of life alone. After all, sooner or later, we will all be seniors. So come join me on this journey where we tackle the tough questions, uncover the truth, and fight for the dignity, fairness, and justice for our aging community. Welcome to Senior Care Matters. Hi, welcome to Senior Care Matters. I'm your host, Dana Arnone, and today we're coming to you from Gurwin Healthcare System. Today on Senior Care Matters, we're excited to welcome Stu Almer, the dynamic president and CEO of Gurwin Healthcare System, one of Long Island's most trusted names in senior care. Stu brings more than 30 years of hands-on leadership, and under his direction, Gurwin has expanded into a powerhouse network, offering award-winning nursing and rehab, assisted living, home care, and the innovative new life plan community, Fountain Gate Gardens. Stu is widely recognized for his steady leadership, his advocacy for seniors and caregivers, and his commitment to providing compassionate, high-quality care to families across the region. From expanding innovative programs to guiding Gurwin through the challenges of the recent years, he continues to shape how Long Island supports its aging population. We are honored to have him here with us to talk today about the future of senior care, the needs of our community, and the work Gurwin is doing to improve the lives of older adults. Welcome, Stu, to Senior Care Matters. I'm so happy to have this conversation with you about Gurwin and all the different services that Gurwin has and offers to the community. Tell us a little bit about Gurwin, how it got started, what the mission of Gurwin is, and exactly what you guys are offering now.
Sure. Well, first, I want to say thank you, Dana, for having me here today. I look forward to sharing our special story and what we've done here at Gurwin over 35 plus years in developing a very special continuum of care. Our origin goes back to the 1970s, which were a difficult time for nursing homes. A lot of issues that were publicly noted that were a concern. There were Jewish community leaders in this community in the Comac area, and we're in Comac, Long Island in Suffolk County, and those individuals were concerned that there wasn't a proper place of quality for the Jewish community. And so those leaders came together and helped form Gurwin, and under the name Joseph Gurwin, who was our founder. So in the late 1980s, our first building was built, the Gurwin Jewish Nursing and Rehabilitation Center, which was at the time a 300-bed skilled nursing facility offering various services. And over the decades, we have expanded into this beautiful continuum of care with all services that anyone would need in post-acute care. There's nothing that we don't do in our system, and we do some very special things as well.
Yeah. I think that's why I was excited to have the conversation with you, because I think that, for families when they're doing their search for whatever kind of care, whether it's assisted living, independent living, I don't think that they understand that there is a place that they can have all those different services provided in the one location. So you said we're in Comac. So the building, the nursing home is in the same spot that it is now? It's the same building?
Correct.
It's expanded?
So we have a 36-acre campus here in Comac.
Okay.
And so we have separate buildings for our nursing home we call the center. We have our assisted living property known as FACHE Lindner Residences, and our newest life plan community that we're here today at Fountain Gate Gardens.
Right.
So together, we have this very special campus. We also own and operate another nursing home about 20 minutes east of here, known as Island Nursing and Rehab Center.
Yeah, I knew that.
It's a 120-bed facility and providing the same quality level of care that we have here at Gurwin. And I just want to clarify, as our mission, we serve all, anyone of any background, any religion, and that's even reflected in our mission statement, that we serve all, and we focus on quality, we promote education, and what we've done here, again, is very special.
Right. So it's not just if someone's Jewish and they want to go to a Jewish facility, it doesn't matter what religion they are, they can come to Gurwin. It's not just Jewish.
Correct. We're open to all, and also all of our programs are open to all.
But so is it a kosher building, though? Is it do they offer kosher?
So in our center, in the nursing home, we are fully glot kosher for all residents in that building. The same in our assisted living facility. not here at Fountain Gate Gardens or at our island facility, but two of our main facilities are where we still have a significant Jewish population.
Yeah, fair enough. So let's talk about the continuum of care, because I think that's something that's so important for families to understand. What does that actually mean? So when you say to someone that you want them to come to Fountain Gate and start the process of becoming, I guess, a life partner with Gurwin, what would that mean to a family?
So we are specially state designated as a life plan community. That means we have the three main components. That is the nursing home, that would be our assisted living, as well as now the independent living that we opened here at Fountain Gate about 3.5 years ago. Just because you build those entities does not mean you're a life plan community. This is a special state application, very heavily regulated, and so we're operating those three. So for someone to enter our system via the life plan community, it's basically an entry fee model. So if someone were selling their home in the community, they could simply buy into living here in the independent living. Should they ever need the services of the assisted living or the nursing home, if they purchase an additional life plan package, an insurance package, they have lifetime access.
Okay.
Even if someone does not do that and they come and live here in Fountain Gate Gardens, they still are entitled to 60 days lifetime if they ever need the services of the other facilities.
Going back to someone who would be interested in coming here, who is like the ideal person or the ideal patient or someone that you think would be interested in the type of programs that you guys have here?
So we know a lot about the members and those who are interested in coming here, and we found that most live in the community. It's mostly couples. Community meaning within the 10-mile vicinity.
Okay.
They've been in their homes for 30 plus years. They want an easier lifestyle, an all-inclusive lifestyle. So they come here and they realize it's just going to be easier for them. It's a safety net approach to coming here. So they've sold their home, they come here, they buy into our program. The beauty of the program is, if someone needs the services of our assisted living or of the nursing home, and they've bought that that package, they're entitled to those services for lifetime. They don't lose the apartment. So a great example is, if you have a couple and the husband and wife are here and something happens with the wife and she needs to move on to assisted living, the husband stays here. They don't lose their apartment.
Okay.
The apartment comes back to Gurwin only at the point that it's fully vacated.
So let me ask you, so you can have a husband and wife, because I think this is interesting to talk about. So, because in home care, what happens is that if someone's on a managed care program and they have a husband and wife, they're splitting the hours, right? So it'll be 6 hours for the husband, 6 hours for the wife. They get 12 hours of care. But if something happens to one or the other, they're reduced down to the 6 hours. It's not like they keep them at the 12 hours. So, indirectly, they're losing half of the hours that they used to have. So I think that's very smart. If they come here, they have their apartment, but if the wife needs to go to assisted living, he can still stay in his apartment.
Correct.
That's so smart.
And they don't pay anything additional. They've already bought the package or they're using up the days that they're entitled to at minimum. And so it works. Even if a single individual moves in here and has sold their home, once they move on, then yes, they've bought into the system. They stay in the system. They don't pay anything more, but then the apartment comes back to us for resale.
A resale. And then when you resell it, it goes where? The money goes to the family?
So when someone comes in, based upon the package that they purchase or the apartment that they buy and the amount they pay up front, it's a little bit complicated, they will get as much as 80% back at the time that they're no longer here in the independent living.
Right.
So again, it's as if you're buying a home, right? You purchase it, put down X dollars, and then at the end you sell it and get paid. You get 80% back, but we handle the selling of the apartment.
Yeah.
So it's just
like a rental
easier.
fee. Yeah.
Like that.
Yeah.
You could almost look at it as a purchase/rental model. Folks who come in who are not going that route of the full life plan package, at some point may have to do planning. The key here is once you come here, you're in our system.
Right.
We're going to work with you. We're going to take care of you. We want you to stay within our system. We've created something special here so that anything anyone needs in terms of healthcare is available to them. And that really is the difference maker here. We have a dialysis center. We have a ventilator unit. We have
That's in the nursing home.
In the nursing home. But we have 2 adult daycare programs. We have 2 home care agencies.
Okay, let's go back. So when you say you have 2, what do you have, a social model and a medical model?
Correct.
Okay.
So,
and that's open to anybody?
So the medical adult daycare program in our nursing home is a daytime Medicaid-funded program. So folks come for the day. They have, of course, socialization, good hot meal, and if they need rehab, they'll get rehab while they're here. If they need to see a social worker, a nutritionist, nursing for Medicaid management.
You're talking about the medical model daycare.
For the medical model program. That's all part of that program.
Yeah.
And we have about 100 people coming per day. So it's a very robust program.
Yeah.
We have a social model program that is mostly a private pay program. Some folks are here covered by insurance. Socialization, most have dementia, memory care issues, and we're a very special provider in terms of memory care. That's important to talk about.
Yeah.
We know in a typical nursing home, about 60% of the population has some form of dementia. We're no different. But where we've taken this to a different level is that we have programming for memory care throughout our system, a lot of education on memory care. But we have 2 dedicated units for memory care. In our nursing home, we have a 60-bed unit that is always full. There's great demand. So if folks have dementia, but they need a secure unit with the right programming, keeping them safe, keeping them engaged, keeping them stable, that program is designed to do that. In our assisted living facility, we have 14 apartments that we're licensed for that are also for memory care. It's a secure unit so that they are safe, again, with all the programming, all the safety and security pieces that need to be in place to keep them secure. So this is a big piece of what we do. In fact, I'm very proud. We have an immersion room. We have a virtual reality room, which is a virtual reality experience, almost like a Disney experience, in our nursing home. So
what is that for?
if we have, and it's on our memory care unit. So let's say we have an individual who got anxiety, and we're having difficulty in managing their anxiety. Let's say that they grew up and used to go to the Yankee games at Yankee Stadium. We could bring them into that reality room, and in this paneled room, they'll come into this experience, and they'll be immersed as if they were in Yankee Stadium.
I love that.
We can bring them to the Bronx Zoo. We can bring them back to Italy if they grew up in Italy. If they're driving, if they like, driving cars, we could put them on the racetrack. I've driven it and I've crashed. It's a great program.
That's for the patients that are individuals that are in the assisted living.
No, that's for the center, the nursing home.
The nursing home.
And that is specifically for those on the memory care unit.
I understand.
Because we have the opportunity to really calm and stabilize someone. If someone did gardening and they're anxious, and now they see the flowers all around them. It also has auditory and smell sensory capability. So we could have you watching the movies and you're smelling popcorn.
Okay. Stu, we're going to come back to that conversation because I actually want to go see that. So we're going to take a short break and we'll be right back.
Body by Peter offers a premier at-home concierge service specializing in empathetic lymphatic massage and blood circulation enhancement. We provide a range of therapies, including red light therapy, wood therapy, body sculpting, and lymphatic detoxification. Our professional and compassionate approach ensures a rejuvenating experience in the comfort of clients' homes. Servicing Manhattan, Queens, and Long Island, New York. Call today, 516-509-3825. Every day, home health aides travel miles across our city to care for seniors who depend on them. But too often, long commutes and poor transportation keep them from reaching those who need them most. At All Things Home Care, we're changing that. By providing subsidized rides, we take the burden off caregivers so they can focus on care, not the commute. Because when caregivers are treated with dignity and respect, our seniors stay safe, cared for, and never alone. Join us in supporting the people who care for our loved ones. Learn more at allthingshomecare.org. We all say, today is the day that we tackle the organization of our homes. The day gets further and further away, but the job never gets smaller. We can take the headache out of planning and doing. We start with a free consultation, create an action plan, and bring you the space and peace of mind you need. We help with home decluttering and organization. Restore your home to a place of comfort. Call today, 516-322-2613. At Reliance Home Senior Services, we believe every day shines brighter at home. As a licensed New York State-based agency owned and operated by a registered nurse, Reliance brings over 20 years of experience and personalized care right to your door. Our certified personal care and home health aides assist with bathing, grooming, dressing, medication reminders, light exercise routines, and to accompany you to appointments, all while offering companionship and a safe, caring presence. Need help navigating Medicaid? We're here for you. Our team of registered nurses and social workers offers in-home geriatric management, so both you and your family can breathe easier. And with 24/7 on-call support, bonded and insured aides, and a custom plan of care crafted just for you, we bring peace of mind right into your living room. Reliance Home Senior Services, bringing comfort, independence, and trust home.
Welcome back to Senior Care Matters. I'm here with Stu of Gurwin Healthcare System, and we're just talking about something that's very interesting to me, is that immersion room for your patients that have Alzheimer's or dementia. So let's just go back to that. So do you find that a lot of them go in there, or is it just like a select few, or does everybody, like, how does that work?
Many of the residents do. It's, again, 60 residents on that unit, and, we'll prioritize if someone has a special need. And again, the calming effect is great. I recall, two residents in particular. I think it was the roller coaster ride, and right. So they're watching the roller coaster, but I enjoyed from behind watching them move
their head,
to the roller coaster. They really felt like they were immersed in that.
That's so interesting. But
what we did was we took it a step further. So the area that you enter before you go into the actual paneled room where you see video all around you. Is the experience. It's beautiful, park-like, unique, because we wanted to create that calm, peaceful setting just upon entering the experience.
Yeah.
Separate from the room itself. It's really special. And now we're bringing it to our assisted living facility. So in a few short weeks, we will have our second immersion room.
That is so like I mentioned, I had Chuck on the show from AFA, and he was showing us that in their site in Amityville that they have, airplane seats and car seats, so that when you're taking someone on a plane, they can do they could show them, or they can start rehearsing with them. This is the chair, this is where you're going to sit, because it's close proximity. He's going to have a whole apartment. Like, it just was so smart. And I think that people don't really know that these things exist. I know in the area in which I do, which is home care, we get calls a lot of times for our families looking for placement into facilities, and not many facilities take long-term care patients anymore. Like, they're always looking for that subacute. So I think it's interesting that people can look at Gurwin as definitely some place to go for long-term care.
Well, it's interesting. If you come into our nursing home for long-term care, let's say you're getting rehab, whether you have a short-term or long-term care, and you go to rehab, and you go into one of our beautiful big gyms, we have an actual car in the gym.
Yeah.
And someone just yesterday upon a tour said, "Why is there a car in your gym?" I said, well, a very important part of rehab when someone leaves is to be able to get in and out of the car for their medical appointments or just for their activities of daily living. So we have the car. But these types of things make a difference. It's our being pet friendly, on our campus, and allowing folks who have pets to move into our independent living. These things just make a difference, because we want people to be able to come here and still have their independence.
Yeah.
We built a
like
dog
themselves.
park. We built a dog park on our campus last year. It's the real deal. And it's besides it being a great safe place for the pets, it's entertainment for folks as well.
So one of the things I want to know, and we spoke a little bit before, is why is this not standard in New York? So we were talking about Florida. There's a few of them. I had mentioned that my grandmother was in one in Ohio. She had passed away on the assisted living side. She never went to the nursing home, but it made it very easy for my mother to go visit her, because she always knew whatever her needs were, it was going to be maintained at that location. So it was easy because my mother was older as well. So why is it that it's not a standard in the industry, and why is it so hard to do?
Unfortunately, there are just 13 life plan communities in all of New York State, and we're one of 3 on Long Island. We're the newest. The regulatory environment in New York is tough. I'm very outspoken about this. We'd love to see change that made it easier and for facilities to be encouraged to develop the life plan model, because we know it works. But unfortunately, it's different here in New York. In other states, there are several hundred life plan communities. And therefore, it makes it easier because the public knows what a life plan community is. The old term was CCRC, Continuing Care Retirement Community, now known as Life Plan. And it's just not as popular here. So we have to do a very, very good job on education of the public so they understand it. Once individuals understand it, as you're understanding it, everyone, says the same thing. Asks the same thing. Why don't we have more of them? What do we do to promote it more? Because again, it works. In our 3.5 years open here, we have had several members who've not been as independent as they were when they moved in and need other services here, and it's there for them. We take our training very, very seriously here, across our system, and I'm very happy and proud to announce that recently we were awarded a significant grant that Gurwin will be the trainer for all of Nassau County and Suffolk County for CNAs, that's certified nursing assistants, home health aides, and what are called PCAs. So that does a few things for us. Number one, it helps the entire Long Island because we will be the regional trainer. We won this award from New York State, and this begins in January for a 5-year period. I've had my own family here as patients.
Yeah, they do a very important job, and I think that people, when we're employing, home care workers on our side too, I think that's one of the things that most people say about us, that we're very good to the workers. Finding good workers is not easy.
It's difficult. We're very centrally located, which helps, but it's still very, very challenging. We have those challenges out east at our other facility, but we work hard at it. We do very good promotion of what we do, but people who come really, we really do care. And if they see that, they feel that, there's nothing better. There's nothing that makes me more proud. If I go out into the community, if I'm dining out somewhere and someone learns that I'm from Gurwin or sees a logo on my sweater, and have positive things to say, it's so important. I spend a lot of my time outside of the offices as the face of the organization, but it's important that our whole team buys into that. And we've really developed that so well, and there's no better promotion than doing that. If it's genuine, if it's coming from the heart, nothing better than that.
Yeah, well, you can tell. So you have a certified home care agency here at CHA. You have a licensed agency here, which means home care workers. You have the subacute facility. So let's just talk about what happens when someone sometimes when they come here, they have these different options. Because I think that also is very helpful for people to understand that if they come into let's say they're at Stony Brook and they need a placement for subacute stay, they can come here, and your social work department actually has other options for them as well, whether it be the home care, whether it be the assisted living. So how do you take me through a normal stay that someone may experience here?
Sure. So most of the individuals who enter our system still enter via the hospital. That traditional model still exists. So our relationship with the hospital systems is very key. Before I get into it further, 3 major hospital systems are all around the corner here on Comac Road. All specialty services that anybody might need are here. So anything beyond what we do in terms of specialty care is available to them. We've even had physicians come from the different medical systems and educate our members on it. So that's something else special that we do. It promotes services for them, and then people know that it's available to them as well. We want the public to know this so that everything is here. So again, the typical individual might have a hospital stay, might be post-stroke, post-surgery, and so they'll come here, they'll have their rehab. Some folks are here for just, a matter of days, and some folks are here for rehab for months. Everyone's different. But then individuals, if they go home, can be in our home care program. Someone can come back and be in our adult daycare programs. They could also then consider they need a little bit more assistance. Maybe our assisted living facility is an appropriate option for them now.
Right.
So we have to do a good job up front of educating anyone who's interested in our system, whether via our website or whether in person, and letting them know that should you need these other services, they're available. I get calls every day from relatives, friends, neighbors, people from the business
Can you get me in?
who need help. Well, a lot of that's the typical question.
Yes. Can you
get me in? We need help. But what I like to convey to them, that we all convey, is that these services are all here. So if this isn't right for you, this will be right for you. If something changes, we'll guide you here. So again, we have to do a good job. You know, you could have all these services. It doesn't mean it works well together.
And it's patient choice. So it's not like they have to take all these services. They can choose an outside person if they want to as well.
And we serve as really as a helping resource to the community.
Yeah.
You know, I receive more calls from people who need guidance on a facility, on home care. They may not even live in this area, but we have a vast network. People know Gurwin, they know us, they reach out.
Yeah.
And I'm just happy that we can help individuals. We're really here to help people. We're a nonprofit, mission-based organization. All of our 7 companies are all nonprofit. We're nonprofits in a for-profit world, so we have to do a very good job to stay viable here, to advocate for our needs, for funding. We want to be here for the community. Yeah. Folks want to be with a nonprofit entity.
We're going to be there one day. You know, that's what I tell people all the time. You know, eventually it's going to be us, and we're hoping that the next generation, you know, will do for us what we're trying to do for, you know, the older generations. Stu, so this conversation is, you know, going very well for me. I'm intrigued about everything that Gurwin is, you know, offering to people, and I'm sure there's a lot of people watching that really want to know more, maybe see more. So if you don't mind, you know, maybe we'll come back for a part 2 and take a tour so that we can actually show people what these rooms look like.
Would love to.
Very good. So just in the interim, if someone wants to reach out, if they want some more information on Gurwin and the Life Plan system, where can they contact you?
So the easiest way to access all information on Gurwin, all of our programs and services, is via our website at www.gurwin.org.
And that's where they can find all of this information?
Everything. All divisions. It's very clearly laid out. A very robust website. Perfect. Very user-friendly.
Okay. And is there a phone number that people can contact as well?
Yes. So another easy way is just through our main number, which is 631-715-2000.
Okay. So we're going to come back. We're going to take a tour, and we're going to show them exactly what Gurwin looks like. So we'll see you next time on Senior Care Matters. I'm your host, Dana Arnone.